Hello and welcome to the Let's Keep Moving series with the American Parkinson's Disease Association. My name is Nick Wendel, and I'm a physical therapist and a board-certified specialist in neurologic physical therapy at Boston University in the APDA National Rehab Resource Center. Today's talk is titled Proactive Physical Therapy for Persons with Parkinson's Disease. I wanted to first introduce myself and thank the rest of the team at Boston University Center for Neurorehabilitation. I couldn't have done this without them, and they are pictured here, so thanks for all their help with the talk and putting everything together. If you'd like to follow us at the BU Center for Neurorehab, we have our social media information and our website at the bottom here. And I also want to make the point that everything that I talk about today is general information and should not be taken as individualized medical advice. But as the title suggests, if you do want some individualized medical advice, I'd recommend talking to your doctor about seeing a physical therapist. So today's focus is going to be on four things. We're going to talk about the importance of a physical therapy examination for people with Parkinson's disease and talk a little bit about what goes into that physical therapy examination. We're going to talk about some helpful questions to ask your physical therapist, things you want to think of before your visit, and also get an understanding of when is the right time to start physical therapy if you have Parkinson's disease. And finally, we'll talk a little bit about some tips and tricks on how to navigate the healthcare system if you're someone living with Parkinson's disease. So to start, we're going to talk a little bit about the importance of a physical therapy examination. It's important to note that a physical therapy examination is highly individualized, so no two evaluations should look identical. It's going to be a lot based on what the person needs to work on or what their movement-related goals are. But there's some key ingredients that are commonly included in a physical therapy examination. And so I'll talk to those a little bit today. The first would be an assessment of someone's strength. And so as a physical therapist, we'll look at, in some fashion, the individual's strength and how it relates to their movement. Another key ingredient to a physical therapy examination is looking at someone's balance. And their balance isn't, this picture with someone balancing a bunch of plates. It's your balance and your ability to move through your environment, to stay steady despite different things that are going on in the environment, whether that's uneven surfaces or changes in lighting. And a physical therapist will look at that balance, even if someone's not having balance trouble, because that's a key aspect of someone's movement with Parkinson's disease. Another aspect of a physical therapy examination is someone's walking abilities. And physical therapists will look at lots of different aspects of walking, from speed to endurance to the quality of someone's walking, depending on what their movement-related goals are. Additionally, a physical therapist will look a little bit at posture for some individuals, because posture can be something that is affected over time as we age, and also in Parkinson's disease in some cases. Finally, a physical therapist will look at different Parkinson's symptoms. They'll look at things like rigidity or stiffness of movement, or bradykinesia or slowness of movement. And they'll look at it in a number of different ways. Depending on someone's symptoms with Parkinson's disease, there may be other aspects that are specific to Parkinson's that the physical therapist may choose to look at in more detail on the examination day. But again, it's going to be highly individualized to that person. A physical therapist also gets some understanding of what a person's baseline exercise and physical activity consists of. And so getting some information about what a person's already doing can be helpful in developing a plan going forward, and also allow the physical therapist to tap into things that the person already enjoys. And finally, there often are some questionnaires that are involved in a physical therapy examination. And these questionnaires can, be a wide variety of types of information, and they help the physical therapist to get that information in the patient's own words, and also help to track progress over time as people go through a physical therapy plan of care. One of the most important things to note about a physical therapy examination is that it's highly individualized to that one individual person. Physical therapists have the benefit of spending a lot of time with our individuals, with our patients, and we focus in very, very specifically on movement. And so we can get a really highly specific and individualized look at how someone's moving to be able to generate a intervention or a plan to help that person move better. The way that the physical therapy examination might look for person A is going to be very different than for person B or person C. My evaluations never look exactly the same because they're so dependent on what the individual presents with. Now that we've talked about kind of what goes into a physical therapy examination, we also want to talk a little bit about what are some of the measures or some of the tests that a physical therapist uses to get a quantification of how someone is doing. So a physical therapist is often going to look at different measures of an individual's strength. And you guys may have experienced this at a doctor's office, or maybe you've been to physical therapy before, and you've seen how a physical therapist or a doctor might push on your arms or legs to get a sense of how strong your muscles in those areas of the body work. A physical therapist also may choose to assess your strength through a functional movement, such as getting up and down from the ground or up and down from a chair in a specific period of time. Sometimes these can be a little bit more functional and can give a little bit more information to the physical therapist about how an individual is moving. Another type of measure that a physical therapist will commonly do for patients is they'll look at their balance. And balance can be looked at in a number of different ways with a number of different tests and measures. Depending on a person's movement-related goals, they might be assessed in balance related to walking, might involve balance with their eyes closed or in dark circumstances, or maybe on uneven surfaces. Other types of balance that a physical therapist might look at are balance when people maybe have their feet closer together or are standing on one leg. They also might look at balance after a trip or slip, looking at how a person with Parkinson's disease is able to recover their balance. There's a lot of different ways to look at balance, and there's a lot of different tests and scores that a physical therapist can implement for people with Parkinson's disease. But in general, it's a really good idea for a physical therapist to screen someone's balance, even if they're not falling or self-reporting any balance-related problems. So even if you don't expect to look at your balance, a physical therapist might do a quick screen because it allows them to understand your picture of how your balance is doing and intervene if appropriate. Another really important aspect of a physical therapy examination is looking at walking. And some measures that are commonly done with walking include looking at someone's walking speed. So often people are asked to walk over a short distance at a comfortable speed and a fast speed, and they can get information about how someone is moving. Additionally, walking endurance is really important to a lot of people. And there are some common tests that physical therapists might do in order to get a better picture of someone's walking endurance. Some of those more common tests include the 6-minute walk test, which is a test where people walk for 6 minutes, or the 2-minute walk test, which is a slightly shorter version. Both of these tests have kind of what we call normative values, or values for people without Parkinson's disease, and also values for people with Parkinson's disease. So your physical therapist can tell you how you stand compared to other people in a similar situation as to you. Additionally, a physical therapist might give you some different questionnaires. And like I said on the last slide, there's a lot of different questionnaires that a physical therapist may choose to use, and it's going to be so dependent on what your goals are for physical therapy. If you're a little bit concerned about your balance, the physical therapist might give you a questionnaire about your balance. If you're trying to establish a new exercise program and you really haven't been able to do that in the past, a physical therapist may give you a questionnaire asking about your exercise history or your beliefs towards exercise, or maybe even some barriers that might get in the way of exercise. These questionnaires help the physical therapist to narrow down their plan and give the most personalized interventions to you. Finally, a physical therapist might also look at something called the UPDRS, or the United Parkinson's Disease Rating Scale. This is that test that you do in the neurologist's office where you move your hands and they move your arms and your legs around. And some physical therapists choose to do this test as well to get a better sense of some of the Parkinson's specific difficulties that some people have. So this gives us, as physical therapists, a little better sense of how someone's slowness or stiffness impacts their movement. So I've just talked about a lot of different tests that may be done in a physical therapy clinic. And I'm curious to hear from you guys. Have any of you done any of these tests in a physical therapy clinic? If so, and if you feel like sharing, please write in the chat what tests that you have done and what did they mean to you? As people are writing in the chat, I think it's also important to note that many physical therapists will choose to share the information about some of the scores that individuals get on different tests. And that can be meaningful to patients because it can let them know where they're succeeding and maybe where there's a little bit of work to be done. It allows the patient to be proactive and take ownership in their treatment, to really focus on those areas where they're having the most trouble. So in thinking about getting ready to go to a physical therapy evaluation, there's some good questions that you want to have ready to ask your physical therapist. In particular, it's important to first think about why you are coming to physical therapy and what you want to work on in particular. A good question I often recommend people ask is, how can we work together to reach my movement-related goals? This allows you to kind of really have an understanding and a plan as to what you can work on together with your physical therapist. And you'd want to have examples of those goals ready. One example that, we can use from our patient in the picture earlier today is, that person was walking, and if you saw on a few slides back, that person was walking a little bit farther behind their partner. A common question that I have, or a common goal that I have for many of my patients, is finding that their walking is a little bit slower than it once was. And maybe they're having trouble keeping up with their partner, a friend, a family member. And so when people come to me and tell me that they are having trouble with that, it allows me to really focus in my intervention and my examination on their walking and specifically their walking speed. And that allows for a better outcome because people are then able to really focus on the thing that's most important to them. Some other good questions, some examples of good questions that are asked commonly when people see me for physical therapy include, what should I expect from my physical therapy sessions? And this is a great question to ask your therapist because physical therapy across the country can look very different. You want to really get a sense of how long are you going to be in a session of physical therapy? Is the session 30 minutes long? Is it an hour? Is it 45? Getting that sense allows you to plan and understand what you're getting into. You also want to know if you're going to be working with the same therapist throughout, or if you might be shared amongst different colleagues. And finally, you want to think about and ask about how long does the physical therapist expect that you will be a part of this course of care. Physical therapy isn't something that you do forever without ever stopping. It's purposely designed as an episodic nature. So you might go to physical therapy for 3 weeks or 6 weeks or 12 weeks. And getting an understanding of what your physical therapist predicts for your length of care is a really important thing to ask about. Another good question that I get asked a lot is, what type of exercise should I focus on? And the answer to that is, it really depends. It depends on your movement-related goals. It depends on what exercise you have access to, if there's certain equipment that's needed, or even what you enjoy doing. Because we know that when you enjoy doing a certain type of exercise, you're going to be more likely to do that into the future. Another common question I get is there anything I can do to help my mobility related to a specific challenge? And I think this is a great question because, again, it allows us as a physical therapist to really personalize that evaluation and intervention and work on the things that are most important to that patient. I also get a lot of questions on different devices. People will see, things online or advertisements, or they'll talk to friends or family or neighbors, and they'll hear about a new device that might help some people with Parkinson's disease or just some people in general. And I think it's a really good idea, if that device is supposed to help with movement, to talk to a physical therapist, because we're movement experts. We may have that device in the clinic and you can try it out right there and then and see if it works for you. Or if the physical therapist doesn't know about the device that you're talking about, they should be able to look into it and hypothesize if they think that would help you as a patient. So you're not just trying things out because they looked good online. Finally, a question that I get a lot, and I think is a really good one, is how can I stay active and stick to an exercise program? And that's really what a physical therapist can be really good at. They can help you to find that exercise program or those physical activity guidelines to help you stick with it in the long term, because we know that's a really hard thing to do. It's a hard thing to do with or without Parkinson's disease. And we as physical therapists want to be there to help you going forward so that you can do this on the long term. So I've talked about a lot of questions that I get often when I see patients with Parkinson's disease, but I was wondering, for you guys listening today, what questions have you asked your physical therapist in the past that you think might be helpful for you to share with other people on this call? I think we can learn from each other. And if you write some comments in the chat, we'll go over them with Theresa at the end today to see what are some good questions that you might want to ask next time in the future. So moving on to the next slide, another question that I get asked a lot is, when is the right time to start physical therapy? So this might be something that we understand, or we ask, or we get information from a doctor or a patient. They might really not be sure, should I do physical therapy at this point in time? But what I can say is, I've seen patients with Parkinson's disease 2 days after their diagnosis, or people with Parkinson's disease that have been living with this diagnosis for over 20 years. And there's always something that we can find to work on in physical therapy. That doesn't mean that I'm always seeing patients with physical therapy for months and months. It may be just a visit or two, but there's little things that can be worked on to optimize exercise and movement for the person with Parkinson's disease. So if you're thinking about starting physical therapy, I would suggest talking to your doctor and getting a referral and starting to see what they can do to help you with your movement-related challenges. One other model that we like to talk about in physical therapy is something we call the dental model. And so I like to think of going to physical therapy with Parkinson's disease like going to the dentist. You don't want to wait till you have a really big cavity that's really painful and that you might have to lose your tooth before you go to see the dentist. You see the dentist early and often, and they clean your teeth and they give you recommendations on how to maintain your tooth health over time. We see physical therapy with Parkinson's disease as the same way. So after your diagnosis of Parkinson's disease, in an ideal world, you're referred to physical therapy. And the physical therapist can get a baseline sense of how you're doing related to all of those different movement-related tasks that I talked about at the beginning of our session today. They can do different tests and measures, and they can get a starting point. And they can get you set up with an exercise program that you're able to stick with over the long term. Depending on the person, that might all happen in one visit. It may happen in a few visits. But at a certain point in time, you'll be discharged from physical therapy and you're going to be exercising on your own. But just like when you leave the dentist's office, they make an appointment for you in 6 months to get that cleaning again. This model suggests that we should make a follow-up appointment for 6 months or a year after someone has been discharged from physical therapy, so that they can check back in with the therapist. They can then see balance-related issues or walking-related issues early on before they lead to significant slowness or difficulties with balance or falls. It allows us to be proactive with our physical therapy instead of reactive, and optimize people's movement over time. So I would suggest, if this is not how you've been practicing or how you've been interacting with physical therapists, to ask your physical therapist if this is something that you can do so that your needs can be met over the long term as you live with Parkinson's disease. Finally, we want to go over a few tips and tricks on how to navigate the healthcare system with Parkinson's disease as it relates to physical therapy. I think it's important to note that most insurance plans do cover physical therapy, and Medicare, which is a common type of insurance that many of our patients with Parkinson's disease have, does cover physical therapy for Parkinson's disease. It's important to know if your insurance plan has a copay or any cost associated with a physical therapy visit. I always recommend calling ahead to your insurance company just to ask what costs you would be required to pay as a result of going to a physical therapy appointment. And if your costs, your copay or your coinsurance are too high for you, I also recommend talking to your physical therapy clinic to see if there's anything that you can do. Sometimes physical therapy clinics are able to waive copays or different things if people have financial hardships, and it never hurts to ask. There's some other suggestions that we have for working with the clinic by first just making sure that you're most prepared for that initial visit. You want to ask if there's any paperwork that you need to fill out ahead of time, and if that's done online or in person with a pen and paper. You want to ask if the physical therapist needs a referral for you to see the physical therapist from their doctor. If you do need a referral, that referral doesn't have to be from any one specific doctor. It can be from whoever sees you most regularly and is most convenient to send over that referral to physical therapy. Not all insurances or not all clinics require a referral to see physical therapy. And there is in all 50 states a law that allows physical therapists to see patients without a referral. However, different insurance companies and different healthcare systems may have different requirements. So it's always good to call the clinic ahead of time and ask if they need a referral from you to see physical therapy. And finally, one additional question that's a really good idea to ask the clinic ahead of time is, how far in advance should I schedule? Sometimes physical therapists book out in advance, 4 weeks, 6 weeks, or potentially more in really busy times. You want to get a sense of how long you'd have to wait to get in to see that physical therapist. So I wanted to just talk a little bit more about our APDA exercise helpline, which is a free resource available to all of you. It's a 1-800 number or an email. And if you call or email this line, you can get your questions answered related to exercise and physical therapy. So if you have any questions, feel free to reach out to one of my colleagues here at the APDA National Rehab Resource Center, and we'll help to get your exercise questions answered. I'm going to stay on here for a little bit longer, and I'm also going to welcome on my colleague Theresa Baker to help go through any questions that you may have related to anything that I talked about today. We've talked about a lot of things, so feel free to write in the chat if you have any additional questions or comments about what we talked about today.
Hi, Nick. Thank you so much for such a great presentation. I think the information is so needed. We have some excellent questions in the chat that I know we'd like to get to. And anyone that's still thinking about a question, of course, if you write in, we'd love to get to as many questions as we can. So I'll kind of just dive right in for a moment, Nick. You asked the group kind of what physical therapy tests have they had done and what did they mean to them? And we had some people write in. Jim wrote that he had had some short balance tests and range of motion. Alan said he had had just what the doctor had done. And then Jacqueline wrote in that she'd had some walking, balance, and posture tests done. So I thought those are all great responses. So we had a question come into us about why would I want to know any of the scores or the times on my physical therapy tests? So I'm kind of curious how you'd answer that.
Yeah, it's a great question. And so I think not everyone might want to know, and I think that's very valid. And so if you're someone that likes data, likes numbers, if that's motivating for you, getting some information about your scores whether it's with balance or walking or strength, can let you know where you stand. And it can also be a way to track how you're doing over time. We do see that many patients with Parkinson's disease improve on these scores throughout a bout of physical therapy. And so knowing what your score was at the start can be helpful and motivating if you're starting to see some progress, and allows you to track it over time in a really objective way. It also can be helpful if you're participating in that dental model of care where you're seeing at various intervals. You can compare how you're doing now compared to how you were doing 6 months ago. And that can be really motivating, and it can also be telling and allow you to help to optimize your program going forward. So I think there's a lot of ways that knowing your scores can be helpful.
Yeah, absolutely. We got another question from Alan, and I think this is something we sometimes hear commonly, even in the Boston area where we are. Alan is going to a clinic, and he has a movement disorder specialist, but he mentions that he doesn't have PT, or there's not a PT who specializes in Parkinson's. So in that case, his question is kind of, what can he do? And I think this is part of a broader question about how could I find a physical therapist in my area that knows about Parkinson's?
Yeah, it's a great question, and it's a challenge. I think it's one of the things that we're going to be talking a little bit just as a teaser about next time with Theresa's talk next month in the Let's Keep Moving series. So I'll talk about it a little bit now, but definitely do tune in next month, because Theresa is going to be going into this in much more detail. So it's a challenge, many parts of the country, to find a physical therapist that has a good understanding of Parkinson's disease. One resource that you can utilize is you can reach out to us at the Exercise Helpline, and we can help you to try to find a physical therapist in your area. But if there isn't a physical therapist that has a knowledge about Parkinson's disease or specialty training, it's important to try to collaborate with your physical therapist. Try to find someone that's willing to learn, that's willing to look into specific areas of evidence, and is willing to work with you so that you can be getting the highest level of care.
That's a great answer. And I think that actually covers a question from another viewer who wrote in. This was Beth. Beth's question was, how do you find a good clinic? And I think, Nick, that answers that question quite nicely. And then, Beth, if there was further questions about that, I think our exercise helpline, that 1-800 number, or rehab@bu.edu, I think we could try to help you with that. We've got a kind of a great question from Fernando. Fernando was asking, can an early referral to PT slow the progression of the disease, help avoid injuries and risk of complications?
It's a great question, one we talk about all the time. And so we definitely advocate for that early referral to physical therapy, because we know that people with Parkinson's disease who exercise and exercise regularly maintain their movement over a longer period of time compared to those that maybe are a little bit less active. And we strongly believe that physical therapists are, well positioned to help patients to find that movement and exercise related program to allow them to maximize their movement over time. There's a lot of different research on how physical therapy and exercise can help people move better and potentially improve their balance or even avoid falls. And so depending on the person's situation, that can be really helpful for people to help prevent or maximize their movement over time.
Yeah, yeah. Another couple questions about, this is one from RW, another from Fernando, a little bit in the category of what should the referral to, what should the insurance referral say for someone with Parkinson's? And kind of dovetailing on that question was, should a doctor refer to PT, OT, and speech therapy simultaneously? I'm curious what you'd say to that.
Yeah, no, I think that's a great question. So as far as what the referral should say, that is kind of going to be a little bit up to the person writing the referral. But at the very least, it should mention that you as the individual have Parkinson's disease, and that's a part of why you're coming to see the physical therapist. Sometimes a doctor might write that, the person is trying to work on their walking or their balance, and that's great. But I think at the very least, having some information about your history of Parkinson's disease on the referral could be really helpful. And then as it relates to speech and occupational therapy, sometimes it's really helpful to do all three of those things at the same time, and you can get a baseline status of how your thinking, your talking, and your occupational therapy type movements, your arm movements, your ADLs, or your activities of daily living. These are all things that a speech language pathologist or an occupational therapist might evaluate. And just like it's good to see a physical therapist early on, often it's a good idea to see an occupational therapist or a speech language pathologist to get a baseline. However, sometimes it can be overwhelming to do all three of those therapies at the same time. It can just take a lot of time. And so you might choose to prioritize one or the other depending on what your goals are. And so I think that answer is it kind of depends on you and your specific situation. But we often find that it can be helpful to do one or maybe two at a time versus all three, just because of the time commitment involved.
Yeah, absolutely. Absolutely. This is another question that came to us. I know you and I hear this sometimes. Kind of the question is, what if I don't like exercise? Is there anything a physical therapist can do for me?
Yeah, such a good question. And
Yeah.
our goal as physical therapists isn't to turn everyone into a super exerciser, but we know that movement can be really helpful for Parkinson's disease. So we as physical therapists, we work with the person to personalize what their movement related intervention or their movement related plan will be. If someone doesn't like, walking on the treadmill, I'm not going to send them to the gym and throw them on the treadmill because that's not going to work long term. We might have to talk about ways to get a little bit of extra exercise when you're going to the grocery store, or we may try to build in strength or balance activities into your normal daily routine. And so it all depends on that person. And that's why I think working with a physical therapist that's willing to personalize their interventions to you can be so, so meaningful.
Absolutely. I just want to comment. David just wrote in. He said, "Please, you might want to mention that physical therapy exams are typically much less painful than dental exams." I think that's
It's a
maybe
great
a
point.
plug.
Thanks for sharing that, David. Yeah.
Nick, we just have a couple more maybe to get to. We had a question maybe on a little opposite of the one we were just asking about exercise. Um, what if I am already going to an exercise class or seeing a personal trainer? Why would I then see a physical therapist?
Yeah, it's such a great question. And the answer is you want to see that physical therapist because they're going to take that well-rounded approach. They're going to look at a lot of different aspects. And they might say at the end of that evaluation, you're doing everything just right. Keep it up, keep up the great work. Or they might find one little thing or a couple little things that you can tweak to maximize what you're already doing. Because a physical therapist is going to take a little bit more time and do a little bit more of a comprehensive evaluation than you might have before you join an exercise class, I think it's a good idea to still have an appointment with a physical therapist, even if you're doing a lot of exercise already.
Yeah, absolutely, absolutely, yes. Um, and I know a kind of questions coming through about how frequently and how often we recommend exercising. That's a big topic, and I wonder if maybe we could even say stay tuned. I know that presentation for next month is going to cover some of our more frequently asked questions, and I think maybe that's a great one we can get to. I've had a couple people here say they have to leave and hope the recording is available. And I know we got a comment from Bob who said he'd appreciate some of the slides from this excellent presentation. I know that the presentation will be archived, so the video recording will be available for people, so they'll have access to the recording and access to the slides on the APDA Let's Keep Moving channel on YouTube. So I know we can, yeah, those comments coming through. Nick, we just kind of had one more kind of comment, and I think this would be great to get your thoughts. This question is, I like the idea of the dental model, but how do I talk to my physical therapist about it?
Yeah, I think that's a great question, a good one to end on. it can be a challenge, right? So you, as a person with Parkinson's disease, are living with a disorder that you're going to live with. And so I think talking to your physical therapist as it gets closer to the end of your care on if it would be okay for you to kind of check in with them at a certain point in the future, because you want to make sure that you're continuing with the exercises that you guys have worked on together, that you want to make sure that you're maximizing your movement related goals. And I think having that conversation can be really helpful. We're finding that across the country, more and more physical therapists are practicing in a similar model to this. And I think if you talk about the reasons why this is a goal of yours, many physical therapists will be very open to practicing in this way.
I very, very much agree with that. Nick, thank you so much. What an excellent presentation. It's such good information. This was wonderful.
Yeah, thank you all for tuning in, and thank you, Theresa, for moderating. I wanted to give a quick plug for the upcoming Let's Keep Moving series. Like Theresa mentioned, it's going to be in May, on Tuesday, May 23rd, and it's going to be titled Frequently Asked Questions About Exercise and Physical Therapy. So you guys had so many great questions today, and we're going to have more of the same and a lot of an interactive presentation for next month. So please do tune in. You can go to the website listed below and sign up for our talk. If you missed anything, please do go back to our APDA YouTube channel. You can see this talk and all of our previous talks in the Let's Keep Moving series. I hope everyone has a great week, and thank you for tuning in.
Hi, I'm Leslie Chambers, the President and CEO of the American Parkinson Disease Association. Each month, across the country, APDA is providing support groups, exercise classes, and educational programs like this one to support the Parkinson's disease community. You can find all of our upcoming virtual events on our website at apdaparkinson.org/events. If you enjoyed today's broadcast, I hope you will consider making a donation to help keep programs like this possible. Your gift can help APDA support people living with PD through local programs, reliable resources, and groundbreaking research designed to find treatments and ultimately the cure for Parkinson's disease. Please donate today at apdaparkinson.org/donate. And thank you so much for your support.